as I said, I would like us to be on the same page because sleep, we would like to make an understanding. If we mention about sleep, that means we have two things to understand. First, we call this as a sleep quality, and the second is a sleep quantity. And within the sleep quantity and the quality, in between, we call this as a sleep pattern. Sleep quantity, that means how many hours you to stay asleep in each night. In the different age group, we have different recommendations for the proper sleep time. In adult, we need it in between 7 and 9 hours to stay asleep in each night, but we need it to be continuously, not just being like a fragmented sleep. No. We need it continuously, and the time to be asleep, that is going to based on the regular rhythm of the brain. We call this as a circadian rhythm. Circadian rhythm, that means the brain is going to wake up and is going to sleep in the period related to the world clock. Usually, if we are going to wake up, we wake up because we have the light. We have the light and stimulated in the eye, and then send the signal to the brain, induce the brain to wake up, to the nucleus in the brain to wake up. On the other hand, if there is no light stimulation at the hiding part, no, at the posterior part of the brain, we have the one part of the brain we call this as a pineal gland. Pineal gland is going to release as a substance we call this as a melatonin. I think we heard melatonin very often. Melatonin is one of substance in the brain that help us to sleep. But if we need to sleep, just only melatonin, it won't give us much effect to sleep. We need to turn off the switch of waking up too. That means we need to turn off waking up brain when wake switch, and we need to turn on the sleep switch. So that should be balanced. That's why if we need to sleep, that's why we need nothing to stimulate the eye. That's why we need to be in the dark room, and also no any noises, because the noise is going to stimulate the brain that help us to be awake. As a proper sleep time, as I said, that is individually for the age group. And in adult, we need it, as I said, in between 7 and 8 hours, 7 and 8 hours for the adult, and 7 and 8 and 9, 7 in between 7, 8, 9, 7, 8, 9 hours. The staging of sleep that many times I try to explain, if the patient, many times the patient provide us the information that this is the information from my application on my watch, and ask me, is it proper time to sleep, or what are the percentage of sleep? We have 4 stages of sleep. We call this as light, very light sleep, deep sleep, and REM sleep. I got many times of the questions of deep sleep is REM sleep. REM sleep is a deep sleep? No, it's not. Very light sleep, or we call this as N1. N1, that means the body, the brain, and also in general body could be relaxed. The second state of sleep, we call this light sleep. The first is very light sleep. The second state is light sleep, still be in light, but deeper. In this stage of sleep, the brain is going to arrange the memory, arrange the information which we learn during the day. And then during the day, we keep it as a short-term memory. And during we are asleep, in light sleep, the brain is going to retrieve those information, and make it to be a group, to do grouping those. And then after that, we are going to go to deep sleep. In deep sleep, for all of this arranging the information, the brain, let's keep those, make it, grouping it, and then let's select which one I should make it to be the long-term memory, or which one I should delete it, or I should throw it away. That's happened during deep sleep. And not only the memory, that is about the repairing system in the body, which is going to happen during we are in deep sleep. After deep sleep, we will go to the staging of REM sleep. REM sleep stands for rapid eye movement sleep. If we notice somebody, we might see that the eye might move quickly, left to right, right to left, left to right. We call this as REM sleep. REM sleep, that means we are going to dream during that stage of sleep. The importance of REM sleep is every dreaming helps the body to adjust and to learn the new situation, such as if we dream about this excited situation, then the body learn, oh, how could I adjust my heart rate, how could I adjust the blood pressure, or how could I train my body to breathe, respond to the different situation. If the person, some person that they said, I want to have a dream, I would like to be only in deep sleep in each night, so it's not good, because that means it's like if before having a task we need to study, we need to try to memorize in each chapter of the book, and then we need to do practice before going to the real examination. It's the same. REM sleep is like practicing before examination, before getting the examination done. So that is the importance of REM sleep. That's why we need REM sleep. The percentage light sleep, we need very light and light, very light sleep for body and mental relaxation. We need it in between 5 and 10. For light sleep but deeper, we need it in between 45 and 50. Deep sleep, we need it about 15 and 20. And for the other 20-25% in each night, we need it to be in REM sleep. That's why we need to be the cycle. As that picture shows, it is N1, N2, N3, and REM sleep. Why did they do the picture like a REM sleep close to awake? Because actually the pattern of the brain wave in REM sleep and the brain wave during we are awake, that looks similar. That's why REM sleep, many times we might wake up because of the dream and we might remember the dreams, but not usually be like that. For the assessment, if you remember, we have the watch, we call this as active watch in the lab. No, not in the lab, I mean in the brain center. We have it, we call this active watch. It's monitored body acceleration, because if we are awake, all of the muscles have some kind of tension. And in this watch, it's going to show the picture of if the muscle tension is too strong, it's going to show that the signal of high intensity or the high amplitude of the body movement or body acceleration as a black bars. But if we are asleep, the muscle will be relaxed. That's why in this picture it's going to show less often that we are going to see the muscle tension or body acceleration. But right now the problem is in our brain center for the watch, right now we have just only not many watch left over, or many watch were broken. So that's why we need other. This we call the sleep diary. We usually record for 2 weeks, ask the patient to record for 2 weeks, and that is a subjective evidence. The patient need to think and write it by themselves, but for the watch, that is objective evidence. Even we have totally subjective evidence, actually that's enough. Many times I ask you help me to translate to the patient that please let them write down the diary, the sleep diary. If they go to bed, just make a signal like the height of the arrow. That means go to bed, and the signal like the opposite of the arrow side, that means out of bed. If that person stay asleep, just drag a line, the dense line. But if like half awake, half sleep, just make the dot line. The reason or the benefit of this sleep diary, we can do estimate the best time for that person to fall and stay asleep, or the bedtime that person to stay in bed. Such as in case, or think about us, If we go to bed, such as if we go to bed at 10 o'clock, I mean at 10 p.m., and if we could not sleep, we stay in bed for an hour, and then we sleep, and then we stay up for 1 hour and a half, and then we sleep again. So the better is we should not go to bed at this time, but better to go to bed later. Because if we go to bed later, that will help us to have more opportunity to stay asleep, being more continuous. For insomnia, we need not just fall asleep very easy, but we also need the continuity of sleep. If that person come to see me because of the insomnia, I need to ask, what time you go to bed? What time you get out of bed, or how often you get up in between, or how often you wake up in between. And do you think how many hours you stay in bed without sleep? Because these help us to do estimate what is the best time that person to stay in bed, or what is the best time, this is the bed time, or what is the better time to be the get up time. That help to stay asleep easier. We call this in the technical term, we call this a sleep restriction or the sleep compression. Stay in bed less as possible. Stay in bed very less. If that person can sleep during staying in bed, but if that person could not sleep in bed, that person should not stay in bed at the time that could not stay asleep. That helps the brain to engage. Bed is for sleep. If I would like to sleep, I need to stay in bed. But if I won't sleep, I won't have the chance to stay in bed. This way we call this as engaging the feeling or the perception of the brain that bed is for sleep only. That means help, this way we call this sleep restriction. That means stay in bed with sleep only. We call this as restriction, which is very important. That's why we need to help each other. That I try to explain to the person who has insomnia that please go to bed a bit later than usual. And then they usually be against that. I don't want to go to bed late. So we need to translate to let them know that the reason that you need to go to bed a bit later, because that helps to train your brain that if you go to bed at this time you could not sleep, then your brain is going to be stubborn and won't go to sleep easy. Then you need to let your brain know, or do like a punishing the brain that if you won't sleep, you won't have the chance to stay in bed. Try to explain to them and make them to understand what is the process of insomnia treatment. Not only the medicine. Medicine is one of the options, but that won't be in the long term for many persons, except if that person have the other comorbidities such as depression, anxiety, or other psychological disorder. We can prescribe that medicine together with the sleep restriction or the sleep compression. For the other sleep disorder, which we usually found the patient, that's about the sleep apnea. Actually, the sleep apnea, that means stop breathing during sleep. Sleep apnea is just only one point of in the big umbrella. We call this a sleep-related breathing disorder. Sleep-related breathing disorder, that means when we are asleep, we should have an ability to breathe in and out well and get the enough oxygen and brain. The brain needs to stay asleep. But for the sleep breathing disorder, the continuum is start from primary snoring. Because when we are asleep, all of the muscle tone will be collapsed, relax, hyper-relaxation and relax, then the airway collapse. If the airway collapse but still having some diameter, we can breathe in and out, but the sound is going to be produced as a snoring sound. However, if just only snore without any effect or other consequence to the brain, to the heart, or other thing, we call it usually primary snoring. more than primary snoring. We call this is upper airway resistance syndrome. So that means if that person wake up in the morning and have the feeling that, oh, I'm tired, I'm fatigued. But when we check from the sleep study or the polysomnogram study, the abnormal breathing index is still be in a normal range. We call this as sleep upper airway resistance syndrome. More than that, beyond that, we call this as a sleep apnea. Many times I interpret the sleep study, the polysomnogram study, and I interpret that the polysomnogram study, we monitor the brain wave, we monitor the breathing via the nose, via the mouth, we monitor the oxygen level, the chest, the belly movement to check how can we breathe. We check the muscle tension in the leg, check the heart beating. If the result showing as abnormal breathing index less than 5, that's normal. In between 5 and 15, that is mild degree. In between 15 and 30, that is moderate degree of sleep apnea. Beyond 30, that is severe degree of sleep apnea. And not only sleep apnea in the meaning that means stop apnea, that means stop breathing during sleep. But actually in the detail, we have obstructive and central sleep apnea. Obstructive apnea, that means the airway collapse. The airway collapse because in our airway, we have the upper airway and the lower part of the airway. In the upper airway from the nose to the mouth and to the throat. In the nose, we have many structures, some structure inside the nose, some structure inside the mouth, which mainly is the tongue and uvula, and also the soft palate. And in the throat, the main structure that are about the muscle. Muscle help to open the airway in the throat. So if that person asks me that, can I do the surgery to treat the sleep apnea? Maybe not, because this is up to the pathology and also up to the severity. As I said, the severity we divide it to be mild, moderate, and severe. And also for the pathology, because we have central sleep apnea and obstructive sleep apnea. If obstruction, that means all of these patterns of sleep apnea, that means there are the collapsings of the muscle that help to open the airway, and also falling back down of the tongue or falling down of the uvula that induce the airway to be obstruct. We call this is obstructive sleep apnea. But if for central sleep apnea that means the airway still be open, but the brain didn't send the command to the muscle and to the brain stem that you need to breathe. So we call this as a central apnea, which related to the brain dysfunction. And not only the meaning of apnea, we have the other term, we call this as a hypopnea. Hypopnea means shallow breathing. Many persons ask me, what is the shallow breathing? Shallow breathing, that means partially obstruct, not totally close of the airway. If totally close of the airway, we call this as apnea. But if just partial closing, we call this as a hypopnea or shallow breathing. This is the meaning of shallow breathing. So we need to explain what is the meaning of shallow breathing and why could not we give you the treatment, just only the surgery. And also from the sleep study, which we see the signal of breathing, we can do estimate that what is the pathology that could be happen in the nose, could be happen in the throat, or could be related to the brain dysfunction. Then this is a sleep study that I show you. We call exactly the name is polysomnogram study. Poly that means many. Somnos that means sleep, and gram that means graph. So that means that is the graph we get from the sleep study. Actually, for sleep study, we have many kinds of sleep study. When we stay in the lab, we call this polysomnogram study. If Some person get it done at home. We call this is a home sleep study. If the study is done during the day could be polysomnogram study, but we call this is daytime polysomnogram study, not the overnight time. Because such as if that person get familiar to stay asleep during the day, such as if that person work as a shift work, so they need to sleep during the day. We make a polysomnogram study during the day instead of the overnight study. More than that, the author of sleep study, we call this as multiple sleep latency test. If some person come to seek us with the problem of hypersomnia or excessive sleepiness during the day, and we check overnight study and we could not find anything to give them the answer of daytime sleepiness, we are going to make the study, set the study during the day to make sure that the brain still work well. If the brain that help, the part that help us to stay awake doesn't work well, could be happen as a narcolepsy. Narcolepsy is an excessive daytime sleepiness with other criteria. We can get the diagnosis to be narcolepsy from the data during the daytime of multiple sleep latency test. And for the other daytime study, we call this as multiple wakefulness test. That we would like to know that person has more ability to stay awake in the dark room or in the situation which might induce us to be drowsy, such as the person who work during the nighttime, such as nighttime driver. It's like that. So I try to let you know that what is the meaning of sleep study and what is the option of the sleep study, which we tailored to in the individual person, and this is based on the history, problem history in each case. The treatment we use this very often. We call this is a continuous positive airway pressure machine, or the abbreviation of PAP machine, CPAP machine, or even the ortho-PAP machine. How does this work? This machine is work as a push the air pressure in the throat. If in our throat collapse, then the air pressure is going to push and open the airway in the throat or even in the nose, and then that person is going to breathe again. CPAP, usually we want to add on the oxygen or connect the oxygen concentrator into the CPAP machine. CPAP machine or BiPAP machine or other PAP machine that help mainly to open the airway. But if that person also has a problem of desaturation or low level of oxygen regarding to the lung problems or other problems about the respirator. If they have respiratory problem, we might need to add on the oxygen together. So the questions we have to get from the patient, is this a machine to produce the oxygen? No, it is not. It's only the machine to improve their ability to open the airway by pushing the air pressure inside the throat and help to open the throat. So this is insomnia, which I already mentioned that. And the other, we call it abnormal behavior during sleep, such as sleepwalking, nightmare, sleep terror, or even like frequent movement during sleep. So many cases they might come to see us and saying as I move a lot. My bed partner mentioned that I move a lot during sleep. Maybe that related to the sleep apnea, or maybe that could be because of the leg movement by themselves. The brain could not control, the brain could not set the command before falling asleep that I am going to sleep, so the body, the leg, the muscle should be more relaxed and don't move when we are asleep. But if the brain could not set the good command, then the muscle tension is going to happen and then we are going to move. Also, the body movement during sleep might be related to the dreaming. Many times we need to ask. To be myself, I ask the person, did you dream last night? I ask about the dream because dream is necessary for our life, not just only in REM sleep, which I said. And also dreams just help our body to do capping or do shaping our emotion. Such as if we have these situations that happened during the day, and if we know how to solve these problems, or some person know how should I think or solve this problem or think about the way to go out from this problem. We call this as shaping the dream. We think from the originated of the problems and we think to the destination. And then when we are asleep, the brain is going to create the dream by the brain itself. And when we get up in the morning and spend the time during the day, the brain has an ability to retrieve the situation in the dream and help to correct the problem during the day continuously and automatically by the brain itself. So this way we call this how to create the dream. But before doing that, we need to access and ask the person that, did you dream? What about the content of your dream? How often did you dream like this? Or what about the precipitating cause or the recently situation which happened in your life? What about your background emotion? And what about your personality? So this means in each question which I ask, what about your personality, what about your emotion, or what about your family, what about this, what about your job and everything. So I ask because I would like to access the background of that person. Not only about the insomnia, but that also help to manage other problems. Not only the insomnia or even not only the sleep disorder. That's why I need to ask in the detail. The other key important for why do we need to sleep, because I am a neurologist. So the main reason that we need to sleep because we need to eliminate multiple toxic waste products from the body. When we are awake, the brain cell, the neuron cells spend a lot of energy, and from spending energy, it's going to have the waste product. So this waste products is going to accumulate in the brain. As this picture is shown, the red color, multiple part of red color that represent for the waste product in the brain. But when we are asleep, in the brain we call this as G lymphatic system. G lymphatic system is similar to the lymphatic in our body, which help to release of the toxic substance out of the body. In the brain, we have some kind of that system which help to eliminate these substance out of the body via the digestive system, via the circulatory, or even from the lymphatic. But if we could not eliminate those, we are going to have a lot of things inside the brain, and that could relate it to the memory disorder, to be the Alzheimer or other diseases of the brain. So, and sleep related to the multiple part of brain function. In this picture, it shows us as multiple part of the brain. Multiple part of the brain is going to work well and also remain the volume of the part of the brain in the normal volume if we sleep in between 7 and 9 hours, or they can make it expanded larger to be 6 to 8 hours. But if for the person who sleep shorter than 6 hours or sleep longer than 9 hours, those persons tend to have the problem of brain shrinking or brain function disorder. The reasons because we know that if we sleep less and also if we have poor quality of sleep, That's about the brain dysfunction, we know that. But if we sleep more than 9 hours, it's similar as the car which we park it for a long time and we don't do any drive at all for that car. That means the next time if we are going to use the car again, we need to do start and warm it for a while. It's like similar with the brain, that we let the brain to be asleep for a while. Then when we need to use the energy from the brain again, we need the brain to work again. We need to help the brain to wake up for a while. So that's why they said the best time to stay asleep, the best duration to stay asleep should be continuously of in between 7 to 9 hours, 7 and 9 hours. This is the best. These are all of the tracker, some example of the trackers, sleep tracker, which might be the watch, maybe the ring, maybe the phone application, and they are going to show us. Is it useful? Yes, it is. This could give us for some information to be background of that person, and then we can do analyze that person baseline from this, and we compare to the lab study, and this is going to help them to monitor in the long term. But we need to compare between this information and also the exactly lab study. So actually it's all done for like in the brief of sleep information which I would like to talk and discuss with you today. So is there anything else you would like me to provide more information, or you have anything to discuss? Sleepwalking is happen because of the brain confused. During we are awake, as I said, we know the brain recognizes I am awake, then I have to the muscle tension like this, like that, like those. And when we are asleep, the brain need to do separate the part of this awake and this is asleep. But if for sleepwalking, that means instead of the brain waves that should be slow like this, it's going to have an intrusion between the wave which still be awake, intrude to the part of the brain which still already asleep. Because of this intrusion, that's why it makes the brain to be confused. We need to find out what could be the etiology or the risk factor, such as mainly we found it very often that is a sleep apnea, obstructive sleep apnea. That's why that made the brain to be confused. Or the other sleepwalking could be related to the other problem of the brain, exactly not only the breathing, sleep-related breathing disorder. So if you ask me what is the sleepwalking we call this is a parasomnia. Para that means beside, somnia that means sleep. Some symptom that happen beside the sleep, that's parasomnia. But the different type of parasomnia we have it is related to the staging of sleep. Sleepwalking is the thing that is actually is not harmful, but it might induce some accident happen. It will be harmful because of that, but not harmful by itself. Yes, this is a sleepwalking, and we usually for sleepwalking very often in the kids, and also screaming on night terror in the kids. So if we find those person, first of all, we need to ask them about the sleep pattern. What time you go to bed, what time you get out of bed, what about during the night, how often you think you could stay asleep, and how often you get out of bed at the night, how long do you keep yourself stay in bed without sleep. We need to ask that pattern first. And then after we get the pattern, then we try to arrange the schedule in the lab. similar to the usual pattern of sleep, and then we check the quality of sleep later. It won't be in rush for the person come to see us and we said, oh, if you have the sleep problem, then go to the lab directly, polysomnogram study directly. No, it won't be hurry like that, because we need to make sure that that person, we already correct other problem for help us to get the better quality of data in the polysomnogram study. The mainly, this is a sleep pattern. This is the main that we should correct it or try to analyze it before going into the lab study. So I remember that many of us here, I remember that we see each other in the OPD. So, and you help me to translate about sleep to the patients very often. So during those periods of time, could you think back, what was your question in your mind at that time during you helping to interpret those? Fragmented sleep, yeah. So she asked me that is it good or not to sleep, such as during the night time, sleep for 4 hours and then it's not enough, and then we sleep again. We sleep again during the day for 4 hours, and we are going to plus that together to be 8 hours a day. No, we could not do that. No, we could not call that as 8 hours a day. We need a continuity of sleep. Because why do we need continuity of sleep? We know that in each cycle of sleep, we need to have very light sleep, deep sleep, and REM sleep. In each cycle, it takes times about 90 to 120 minutes in each cycle. And in one night, we needed 3.5 to 4.5 cycle a night. So if we sleep just only 4 hours, that means you could not complete your sleep in each night. In that night, yes, you could not complete the cycle in that night. That means about the degradation product and many waste product, you could not clear it during the night time. And then when you sleep during the day, you need to create the cycle, the new cycle again. But to sleep, the substance or the chemical which we need to sleep, not just only the melatonin, but we need other substance such as, actually we call the name is adenosine. Adenosine is a degradation product from the ATP or the energy that we spend during the day. If adenosine is high in the high level at the time, such as you sleep in the evening, you tend to wake up, and after you wake up, you will be confused in the evening if you wake up. Because in the evening, the adenosine or the degradation product from the energy is too high. That's why you will be confused, because adenosine helps you to stay in the deep sleep longer and stay asleep longer than usual. So that's why and that means in the evening, even you sleep, but you won't complete your cycle of sleep. It's like when our cycle is broken, such as in light sleep, we know that, okay, body relaxation, mental relaxation, and then we are going to prepare the information before do condense it in deep sleep and then practice it. And after that, you wake up from light sleep, then you could not make the long-term memory from the sleep. That means that sleep cycle, the qualities might not be good enough if we compare to the nighttime sleep. But it doesn't mean that we should not sleep during the day. We can sleep during the day if the nighttime is not enough. We can take a nap during the day, but taking a nap during the day, we need the time to take a nap to be the right time, and also should not longer than 1 hour for napping, and should not later than 2 o'clock in the afternoon. Because if we take a nap longer than 1 hour, it's going to be the next cycle. It's going to go to the next cycle of sleep. That means it's going to disrupt your sleep at night. And also, if you sleep longer than 120 or 90, 90, no, I said in the cycle of sleep, it is 90 to 120 minutes in each cycle. If you take a nap longer than half an hour, that means during that period, you are going to go to deep sleep. And if you get up from deep sleep, wake up from deep sleep, you will be confused. Your brain is going to confuse. And you will feel like, oh, I'm tired. However, if you think you would like to complete your staging of sleep and make it to be 2 cycles, that means this cycle is going to disrupt nighttime sleep. So that's why we said if you take a nap, we should not take a nap longer than half an hour. And also if we take a nap after 2 o'clock in the afternoon, the problem is not only it will be in the same reason, and that look like to disrupt nighttime sleep easier than we take a nap during the morning time. So this is a nap. So what else? ขอบคุณค่ะ